Okay, I think we'll have another very interesting discussion with Dr. Neal. So one more question is, few of our patients here, they are menopausal ready. After taking bioidentical hormone optimization, they start to have their menses again. And then they are very skeptical and very disturbed by this feeling. And they are feeling like, is there something wrong with it? Maybe Dr. Neal can share with us about his experience on these cases or issues.
Women had periods for 30 years, and then they stop. And then when they start having periods again, they're afraid that something's wrong. Well, if a woman takes hormones and starts to have their periods again, that means they were not menopausal yet to begin with. Their levels were low enough where they were not having their periods, but not low enough to put them into menopause. So this is a rare case where a woman is in what's called peri-menopause. There's premenopause where you menstruate normally, menopause where you don't menstruate at all, and perimenopause where you have menses, no menses, menses, no menses, heavy bleeding, light bleeding. That's perimenopause, and anything that happens in perimenopause is considered normal. So if a patient starts to take the hormones and bleed, we don't want them to bleed, we don't expect them to bleed, you should not bleed, but in some women that are in perimenopause, they're not in menopause yet, and they may start having periods again. That's very rare, but they're having their periods again because they were not in menopause yet to begin with. When a woman is in menopause and starts hormones, they will not bleed. We don't want them to bleed. They don't need to bleed. So if they're bleeding, it's because they're not in menopause yet. They're in what's termed perimenopause still. And in perimenopause, women will still have menstruation or menses, sometimes for a month or two or three, then they stop, sometimes for a month or two or three and stop. That's perimenopause. It's normal, it's expected, it's not harmful, it's not bad. Hormones don't cause cancer, and no, we don't expect you to bleed. Well, as you well know, most doctors do not understand menopause or perimenopause, and that's why you're so well trained to be able to figure out when a woman is in perimenopause and when she's in menopause. You can do the lab test to determine that and look at her history. So if you determine a woman is not in menopause, you're not going to give them estrogen, and they typically will, not have to worry about menses. But women in perimenopause will have irregular periods, and that's normal. Menopausal women, no, you're not going to have periods, no, you won't bleed, don't fear that.
If in case the lady just coincidentally perimenopause and being prescribed on this hormone and they are having their menses, what should they do? Should there be anything?
They don't really need to do anything. They're going to have a normal period, and the normal period is going to stop just like it always has. Sometimes if the patient wants to, you can stop the hormones, but the period is going to stop on its own. And then you need to continue the hormones. Because again, they're not in menopause yet, they're in perimenopause. And they may have one or two more periods because that's normal.
So actually it's a transition periods that certain ladies will feel and face this kind of problem, but it's normal, completely normal, right?
Precisely, it is a transition phase. The term that we use for perimenopause is anything that happens is normal. It's also called no man's land because no man wants to treat it, because every time they treat somebody in perimenopause, something happens like they bleed. So it's no man's land because no doctor wants to treat it because they're afraid of it. But women in perimenopause absolutely need progesterone. It protects them against cancer, it helps treat their hot flashes and night sweats that they get in perimenopause. And then once they become menopausal and cease having periods and have an abnormal lab test, and they're definitely in menopause, then you add the estrogen.
So I think Dr. Neal bring out a very important point here is actually for ladies that would like to prevent aging during perimenopause, we can start on with progesterone.
You can start on progesterone, thyroid, testosterone, DHEA. All of those hormones are beneficial for your long-term health and for how you feel and how you function. And it'll help treat your symptoms of perimenopause during that time phase. Then when you become menopausal, then you add the estrogen in the form of bioidentical estradiol.
Bioidentical estradiols. All right, that's very important. All right.